HPV is the most common viral infection of the reproductive tract. Most sexually active men and women will be infected at some point in their lives, and some may be repeatedly infected. But does it cause cancer, or can it correlate with common cancers? And to tell us more is Michael Herbst, clinical health specialist at CANSA. Good day, Michael. Thank you for joining me.
Good afternoon to you, to all your listeners and viewers.
All right, so Michael, before we get into HPV and cancer, how do we better understand HPV?
Well, I think you said some very important things right in your introduction, and that it is the most common sexually transmitted infection, and it is infected, by skin-to-skin contact. That's very, very important to remember. And there are just over 100 of these human papillomaviruses around, of which about just nearly 20 are said to be high-risk human papillomaviruses. And they are the most important ones when it gets to the different cancers that they can cause.
Hmm. And how common is human papillomavirus and the health problems caused by it?
Well, let me tell you that there are hardly a human being around, especially after puberty, and after having had at least one sexual contact in their life, that hasn't been exposed to the human papillomavirus. But fortunately, the immune system of the body has the ability to overcome the virus and to work it out of the system. But in a large proportion of individuals, it happens that the virus stays, and that for those individuals, it can cause really very severe health problems. And some of the health problems that can be caused by the different papillomaviruses will be cancer of the cervix, cancer of the vagina, cancer of the vulva, the penis, the anus, and in the men, in the oropharynx, that's the mouth, nasal passages, and throat, as well as anal cancer and penile cancer.
Hmm. What can be done to reduce the chances of getting HPV?
You touched on something very, very important now. People whose children attend public schools, those are all the schools that are funded by the Department of Education, or Basic Education, including the old Model C schools. They have an annual program where the girls between the ages of about 8 and 12 years old get the opportunity every year to be vaccinated free of charge, and they get 2 vaccines a few months apart. But for these girls to get this vaccination, parents have to sign a consent form. And I want to make a plea to all parents. Please do not refuse to sign the consent form. There are so many anti-vaccine stories going around, and it's doing such a lot of harm and preventing people from being protected against very, very important illnesses. And here especially we think of the girl child, of cancer of the female genitalia, and we must really ensure that they will get the vaccination. So that is the sure way of protecting every girl for the rest of her life, to get the 2 vaccines offered free of charge by the Department of Basic Education.
Mm-hmm. Right now, let's get into the symptoms. How would one know if they have human papillomavirus?
Most people are symptomless unless they have a variety of the different viruses. And here I mentioned earlier that there are just under 20 of them, which we call high-risk viruses. And some of these viruses are responsible for causing warts. Now, if you have an infection of that type of virus that will cause warts, you will get warts on your body.
Mm-hmm.
But not all of them cause warts. Some of them, and the most important ones, will be the ones that causes the different types of cancer. And here, the symptoms are not always clear,
Mm-hmm.
and very often the symptoms come rather late, and by that time, some cancer may already have started in the body.
Mm-hmm. And then when we talk about diagnosis, how is it diagnosed? Is there a series of diagnoses, or can the healthcare provider just go through one process?
Well, there is an HPV test, but it's rather cumbersome and it's rather expensive as well.
Yeah.
The most important thing is that every woman should go for an annual cervical smear
Mm-hmm.
as from about the age of about 35 or 40 years of age. Unless she's got symptoms that concerns her, she should speak to her treating physician and to find out whether it is time for her to start having uh, cervical smears done.
Mm-hmm.
And by having a cervical smear done, early changes in the cells of the cervix can be picked up, and then proper and adequate treatment can be instituted before cancer finally develops.
Mm-hmm. Right. So, is it easily treated? Would it just require some medication, or again, does one need to go for surgery?
Well, it all depends again on at what stage the diagnosis is made.
Mm-hmm.
If there's already a diagnosis of early cancer, then maybe additional treatment and even maybe cautery or a cold treatment or acidic treatment or something needs to be given to the cervix or the vagina or the vulva. And if not treated, it can really cause severe problems like cervical cancer, vaginal cancer, vulval cancer in the men, the penile cancer, and anal cancer. And by the time that this is diagnosed, there can be severe complications which may require extensive surgery or chemotherapy and or radiation therapy.
Mm-hmm. And would that also include or cryosurgery when it
So
comes
that is the
to
cold treatment that I mentioned. That's cryotherapy.
all right, and that would mostly be used in treating the warts, correct?
Mostly for the treatment of the warts, yes. Because you must remember that these warts can also develop in the genitalia of both men and women.
Mm-hmm.
And it's not something pleasant to even see, and it's very unpleasant for a person who has it.
Mm-hmm. Yeah, I can just imagine the pictures are not something that you want to see. But a last words, any takeaway points that we should take note of?
Yes, I think the important thing is that we must provide the opportunity for every girl child attending any of the public schools in South Africa, where the opportunity arises, that parents must please sign the consent form and have the girl child protected against the human papillomaviruses. This will prevent them from developing any of the cervical cancer, vulval cancer cases that would be in their future if they are not vaccinated at all. That is the important thing. And then for every adult woman to every year go and have her cervical smear done to see if there are any changes, and that this can be diagnosed early and early treatment can be instituted.
All right. So thank you so much for your time, Michael, and have a wonderful day.
A lovely day to you and all your listeners.
Thank you. That was Michael Herbst, the uh, clinical health specialist at CANSA, talking about human papillomavirus or HPV and how it correlates with common cancers. And you heard there, common cancers you can experience, or rather, you will get one of those cancers that he mentioned, like cervical cancer is one of the most common ones there. Also, penile cancer, uh, um, and well, it doesn't just cause cancer, but also other health problems. In most cases, HPV goes away on its own and does not cause any health problems. But when it doesn't go away, then it can cause problems like genital warts. Genital warts usually appear as a small bump or a group of bumps in the genital area, and they can be small or large, raised or flat or shaped like a cauliflower. Not something pleasant that you want to experience. So make sure that you go for checkups, regular checkups. And if for the parents who do have children who are in school, please allow them to get the vaccine, the HPV vaccine, because this will help them as they grow older into young women. And women should also, older women, between the ages of 35 and above, should go for regular cervical pap smear tests, just to ensure that everything is fine down there and there's no HPV or any other underlying problems, because early detection does save lives. So make sure that you do go and get yourself detected early enough. It is at 12:47. You're listening to the Mid